Hello, future PTAs. I hope you guys are doing well. Today, we are going to talk about shockwave therapy. So, here is our outline. Some of the physical properties of shockwaves. So, they are high amplitude, short duration sound waves, asymmetrical, the initial brief, rapid rising, high intensity compressive phase, and that's followed by a long, low intensity tensile phase. So, there's like a quick burst and then a slowing down of that wave. In the uh, transducer before it like hits the skin. There are several types of shock waves. So focused has a short duration, a high peak pressure. It is dispersed at the applicator and it focuses on a target 2 to 4 inches deep. Radial or pressure waves have a longer duration, a lower peak pressure, and they last longer. So generation of shock waves. So radial shock or pressure waves are generated by pneumatic compression. So the compressed air accelerates a ballistic projectile in the handpiece of the device. Then that projectile slows quickly and before it hits or as soon as it hits the transmitter. If the transmitter is in contact with the skin and has a coupling agent, kind of like ultrasound gel, and good contact with the skin, then it exerts a rapid compressive force followed by a slow distractive force. So it quickly hits the skin, and then when it repels back, it kind of distracts and pulls the skin back towards it. So this is a shock or pressure wave. That's how shock wave therapy works. Some of the parameters, the energy flux density or EFD is measured in megajoules per millimeter. It has a low, medium, and high frequency that you can choose. The peak pressure is measured in bar or megapascals, MPa. 1 bar equals 0.1 megapascal or 10 equals 1 megapascal. Shockwave frequency is measured in hertz, and then total shock number is also another parameter, and treatment duration, which is always in minutes or seconds. Some of the effects. So there's the cavitation, which we have learned about before. With other modalities, this increases your cell membrane permeability, so it triggers cellular repair and tissue healing, increases that microcirculation, metabolic rate, a release of cytokines. It breaks up calcification and it remodels fibrotic tissue and scars. So the bottom two are like the most important and specific about this modality compared to others, that shock waves break up calcifications and they help remodel scar tissue. So make sure you remember that for sure. All right, clinical indications for shock waves. You can use as an adjunct treatment for recalcitrate inflammatory conditions. So some of the conditions that would fall under that category are things like tendinopathies, calcifications in any muscle, but rotator cuff is an example. But anytime there is like a bone calcification in a muscle, this would be a good indicator for this type of therapy. Patellar tendinopathy, plantar fasciitis, trochanteric bursitis, all of those could be benefited from shockwave therapy. This can promote tissue healing, such as with chronic wounds or delayed or non-union fractures. So it can be used for a lot of different medical diagnoses. FDA approved uses of, I put it below because I knew I would forget what the acronym stood for. E is the electrocorporeal electrocorporeal shockwave therapy. So the R in front of it stands for radio. The F in front of it stands for focus, like we learned before, the two different types. And so for the radial type of shockwave therapy, it helps with reducing muscle pain and aches, increasing blood flow, activating connective tissue. With the focused shockwave therapy, it helps with kidney stones or plantar fasciitis, lateral epicondylitis, diabetic foot ulcers. So all of these conditions can be helped. Some of the contraindications for shock waves. If there's cancer, pregnancy, you can't do it over lung tissue, over bleeding in the treatment area, Any or increased bleeding risk, such as someone with hemophilia or somebody that's on blood thinners. You don't want to use it over growth plates. If they have um, back pain or whatever like that, you don't want to do it directly over the spinal cord or the brain tissue. You do not want to use it over infected skin or broken skin, over a pacemaker or any type of implanted cardiac device or defibrillator, or over cement. I think I successfully sneeze in every recording. I'm allergic to this. um, if there's cement that's holding a prosthesis or anything together, you don't want to do it over that area either. Some of the precautions are unexplained calf pain or like a deep vein thrombosis, blood clot, bony prominences. So you don't want to do it just directly over bone without much tissue there. Or if they have significant or unexpected pain, then you would want to stop the treatment immediately. Some of the adverse effects of shockwaves, it has nothing to do with a wasp or hornet sting. It's just that's what PowerPoint suggested, and I liked the picture, so I just thought it was funny. So we'll just keep it there. But it could cause bruising. Petechiae are those like red splotches on the skin. It could cause reddening or skin irritation, swelling, pain during or after treatment for even up to 2 days after the treatment. When you are applying shockwave therapy, you want to choose the right device, use the gel like ultrasound gel. Um, you want to clean the device like an alcohol wipe or something, and then have a paper towel nearby just to wipe up and clean up afterwards. You always, just like with other modalities, evaluate and determine if it's safe to perform the modality first. Then, with shockwave therapy, of course, you want to expose the skin that you're going to be applying it to. Apply the ultrasound gel, select the parameters. Remember, I usually do that in reverse because sometimes the gel will just slide right off the skin. So I usually get the parameters all selected and then put the gel on. Place the applicator on the skin before you turn the machine on, just like with ultrasound. And then check that the patient's not in pain during the treatment. And at the end of the treatment, you clean up and you reassess and determine, do they have more movement or less pain or any changes after the application of the treatment. With the parameters, so there's the focused and there is the radial types of shockwave. So the focused is on the left, the radial is on the right. And you have, same as we talked about in the first slides, the measurements, the energy, flux density, the peak pressure, the shock wave, the total number of shocks, and the treatment duration. We've already spoken about that. With documentation, you want to document the area of the body that was treated, the type of device used, whether you use focused or radial, treatment parameters, peak pressure for the radial type, total shock number for radial, and frequency for both radial and focused, and then their response to the treatment. All right. So that is all there is to shockwave therapy. So I will see you guys in the next lecture.